I'm Sarah Poliano. I'm a veterinarian at Animal Clinic. Today we're going to talk about spaying and neutering your pets. We recommend spaying and neutering your pets. If they're not going to be a breeding pet, if you're not going to try to breed them, or they're not going to be working dogs like a police dog, spaying and neutering is recommended for all household pets. We recommend this to help combat overpopulation and also to prevent some increased risk of some diseases and cancers, as well as some behavioral issues. Reasons to neuter your male pet is it decreases the risk of certain conditions like prostatitis or infection of the prostate cancer, testicular cancer, and then certain conditions such as a perianal adenoma, which is a benign tumor in dogs. The other reason is behavioral. Obviously, at certain times they may be a little more passionate or aggressive, as well as marking behaviors in the house, and you can see them increasingly prone to roaming or getting out, which obviously increases their risk of certain diseases and getting hit by a car. Reasons to spay your female pet are obviously we're going to stop the heat cycles. With those heat cycles, those hormones are going to go up. Obviously, there's a risk of pregnancy. Over time, they're also going to, with each heat cycle, increase the risk of mammary cancer or breast cancer. If pets are spayed before the first heat cycle, it virtually eliminates the risk of mammary cancer or breast cancer. It's going to go down to less than 0.5 percentage point. Also, you're going to decrease your risk of certain cancers such as ovarian and uterine cancer. Pets, as they age and they go through multiple heat cycles, that also increases their risk of a pyometra or infection of the uterus, which actually can become a life-threatening emergency as they get older. Similar to males, there can be some behavioral issues as well. When they are in heat, they are more prone to try to get out of the yard, roam. They have those urges, so they can unfortunately put themselves at risk of trauma or injury as they escape the yard. Sometimes people ask us what might be disadvantages to spaying or neutering your pet. A lot of times they've heard, my dog got really fat after the procedure. We do find, just as we age and hormones change, that sometimes the metabolism will go down slightly. So you may find that your rambunctious puppy was having to eat a lot more, and after the heat cycle, actually their caloric intake needs to be reduced slightly. So usually we're going to recommend monitoring that, keeping them active, but possibly reducing the amount of food offered by 1/4 to 1/3 of the amount per day. Another question people ask is, when should I get my pet spayed or neutered? That can vary somewhat with the breed and size of your dog. So best to talk to your veterinarian specifically. The earliest we typically will recommend it here is around 4 months. A spay or neuter is a general surgical procedure, so they will go under general anesthesia, and just like you or I, any procedure, there is a small chance of complications. Here at A-Animal, we're going to do our best with state-of-the-art monitoring and gas anesthesia to reduce that risk as much as possible. But remember, it's very minimal risk. On the day of your procedure, your pet will be dropped off. We'll have a pre-surgical examination done by a veterinarian, and then we'll do some blood work to make sure their organ function and immune system is healthy enough to go through anesthesia and the surgical procedure. Once they've been checked out thoroughly, we'll go forward with placing an IV catheter to allow us to give IV anesthetics, as well as some cardiovascular support for them through IV fluids throughout the procedure. Once they're under anesthesia, we're going to have a breathing tube or endotracheal tube placed in their windpipe that allows us to give them gas anesthesia and oxygen therapy throughout the procedure. As far as recovery time goes, They're going to be recovered from anesthesia in the hospital with a veterinarian or technician. Once they are fully awake and ready to go home, we will send you home with some anti-inflammatory pain relievers to make sure they're comfortable in the recovery time period, as well as one of the famous lampshades or e-collars to help prevent them from licking their incision or kind of pulling our stitches out. What you should be aware of afterwards is that we want to keep an eye on the incision, make sure it's clean, they're not rolling around, taking muddy baths in the backyard or anything like that, and then we keep them from being too crazy or busy afterwards. We do have an incision. We don't want them running around, jumping, playing, so they will need to be kept kind of low key for about 1 to 2 weeks, depending on which procedure they have.